Hi, I'm Vanessa. Thank you very much for coming, Daniela. So you have come here today to have a uveitis screen. Do you know what a uveitis screen is? No? Okay, well, it's having a look at your eyes. I'm going to check your vision, and then we're going to have Dr. Small have a look inside your eye just to make sure there's no inflammation in your eye.
Why do I need this test?
We thought you should have this test because you've got arthritis, juvenile idiopathic arthritis. Do you remember you had a swollen knee, I think it is in my notes it said? Yeah. Sometimes little boys and girls can get what we call the uveitis, inflammation, not just in their joints, like your fingers that move and your knees that move, but inside their eyes as well. But if we were just to look at your eyes, you wouldn't be able to tell. So we need to have somebody have a good look inside the eye.
Does it hurt?
It definitely won't hurt, Daniela. The only thing we have to do is cover one eye up with a patch, and we'll check your vision one eye at a time. How old are you now?
9.
9. In that case, I can use this. Do you know all your capital letters?
Yes.
Yeah? Can you see them? Okay. Shall we get on and do it then? Perfect. Now, can you see anything through? If you close this eye, can you see anything there?
No.
Perfect. Let's get you up and ready, move you across. Okay, Daniela, I just want you to tell me what that top letter is.
A.
Perfect. What's below that?
H-L-A-O-T.
Excellent. And the line below that, they're getting small.
O-T-L-H-E-N-A-G.
That is fantastic vision. Well done. Okay, so I'm just going to write that down, and then we'll do vision in your other eye and get you through to see Dr. Small.
Hi Daniela, I'm Conrad Schmoll, I'm the eye doctor, and I'm going to look at your eyes on this machine here and check if there are any signs of uveitis in your eyes. So what it's got is some handles there for you to hold, and there's a bit there for you to put your chin in. So we're going to get you to put your chin up there and your head right forwards there, and then I'll switch on the light and then I'll have a look at your eyes. And I'm just going to look into your eyes now with this light. And while you're sitting there, you can just look at my ear on this side. Perfect. Very nice. That's lovely. I'm having a good look at that eye, and that one looks very nice. Right, let's look at your other eye now. And if you'd like to look at my ear on this side now, you're doing very well. Oh, that's perfect. I'm getting a really good look. And I'm looking in your eyes for any spots causing bother. They look very good. Super. Well done, Daniel. Yeah, you can sit back now. So everything looks fine. That's your examination for today all finished. I'll need to bring you back and have a look at your eyes again in a few months' time, because if there's anything starting to develop and we find it early, then we can treat it. So I'll make another appointment for you to come back in 3 months, and I'll look forward to seeing you then.